Hello and welcome to e-DIRAP Hangout on eHealth. I'm Christine Apicol, and together with Cairo Yusuf, we're part of the e-DIRAP team that will be hosting this Hangout. Today we have 4 panelists from civil society, academia, and private sector. Hopefully there'll be 2 more panelists, and hopefully they'll be able to join from Thailand and from Malaysia. So today we'll be discussing the topic of e-health, and e-health is being very broadly defined here as the use of information and communication technologies in healthcare. So in this Hangout, the panelists will help us understand how ICTs have contributed to addressing some of the key issues and concerns in healthcare. We'll find out about current and upcoming ICT initiatives and innovations for improving healthcare in different countries. And we'll also be discussing the complex challenges and way forward for harnessing ICTs to achieve health outcomes in Asian countries. 1 hour, and we'll begin with a round of introduction, followed by about 40 minutes of discussion among the panelists. And in the last 15 minutes, the panelists will answer questions from the viewers. So to the viewers, please post your questions and comments on the e-DIRAP Google Plus page or on the e-DIRAP YouTube channel. So let's begin now with a round of introduction. So if each panelist can tell us a little bit about yourself, your work in the health sector, and the role that ICTs play in your work. So let's start with Albert.
Okay, hi everybody. I'm Albert Pratama from Yogyakarta, Indonesia. I'm currently leading a developer team. We are developing a health information system, specially designed for public health centers. We call it Puskesmas in Indonesia. And we already implement our product in 400 or more PSCs in Indonesia, and we are still maintaining most of them. I think that's for now.
Thank you. And Brian?
Hi, I'm Brian Larish, and I don't work in health directly, but more from a civil society angle, dealing with poverty alleviation and dealing with health issues. So at the moment, we are starting a pilot program in one of the 13 states in Malaysia to basically crowdsource support, financial support using an ICT platform actually. For example, a woman in a rural area who goes through our early breast cancer awareness program, and if there is any sort of abnormality located, what would happen is we would put that up via the ICT platform for crowdsourcing for people to sponsor her mammogram and her pap smear. So these are, I mean, in a nutshell, I'm simplifying it. Of course, there's a lot more processes involved in it, but it's an idea for coordinating non-profit and government efforts to be more constructive with public support, financial support, so that it's more effective using ICT basically.
Thank you, Brian. And we have Dr. Fahim from the e-Health Association of Pakistan. He's the General Secretary of the e-Health Association of Pakistan. He has a little bit of problem with this microphone and speaker. So perhaps Maria Arif, who is also from the e-Health Association of Pakistan, can explain more about the work that you're doing.
Okay, thank you, Christine. Hi, everybody, all of the panelists. I would have hoped that Dr. Fahim would have been hearing us and he could give his own introduction. Yes, Dr. Fahim is the General Secretary of e-Health Association of Pakistan, which is an organization in Pakistan providing a platform to all health-related stakeholders. He is currently working at Aman Foundation as the head of Health Call Center, a call center providing health advices to all of the people 24/7. Okay, and this is one of a sort of a health providing call center in Pakistan as well. The first, and and I'm Maria Arif, and I'm the coordinator for the association. So I manage and coordinate all the board members of my association, scattered locally as well as nationally, as well as internationally. So I would love to give you answers on all the chats. Christine, you may continue now.
Thank you. Okay, so I'd like to ask each panelist, what are some of the key issues and concerns surrounding healthcare in Asian countries? And how are ICTs being used in various initiatives to address these key concerns and issues? Would anyone like to start?
Maybe I can. I mean, actually, Malaysia has been quite active with this. In fact, before 2000, some of our offices have, our hospitals have already gone paperless in Malaysia, and you know, to the extent that many of the hospitals now, to the point of even the ambulance first, are on a what do you call it, on a platform. They can even register their route when they go and pick up patients. And if anything happens during that itself, the doctor can already intervene for the paramedics to work with the patient who's sick. So in that sense, Malaysia is fairly advanced in that way. But I think with all issues that are new, it is people getting, it's the hardware and software is easy to implement, but the actual human perspective on how to manage this is the issue, I think, has been in Malaysia, I think.
Thank you for that perspective. Albert, would you like to share the Indonesian experience?
Okay. Here in Indonesia, we are still having problems with data reporting from the PHCs to the central government. Not all of the PHCs has sufficient human resources and computers to send a report each day or each month. So what we are working for is to provide the PHCs the tools, the softwares, and try to make them aware that the data is important, that so the government can create the correct policy to for health. So in some PHCs, there still doesn't have patient medical records, and they even don't have a special person to handle the data. So we are not working only on the software things, but we also need to train them to make them aware that the data is important.
Okay, thanks. Maria, would you like to share the Pakistan experience?
Sure. I would be discussing what Dr. Fahim has already mentioned in his answer, is that the Pakistan, there are three key issues in the healthcare industry. The first of all, I guess maybe in all other countries as well, is access towards basic health, okay? The second one is affordability, and the third one is quality of healthcare. So the ICT may help to cope these challenges through providing basic health, using like telephone, using other technologies, like when using internet. Basically, if we say that people far away can get health advices, or can know how they can be taking care of their patients using internet or mobile phone or things like we call ICT. And growing these things are, these services and things are very famous in Pakistan these days, and are growing very fast due to availability of mobile phones to almost in every household. and people only, by sending a simple message, we are providing basic knowledge to people who do not know even to take care of the babies. This is a small issue, maybe.
Mhm.
Okay, thank you. So I think just from this, we can see that there's a wide spectrum of possibilities that ICTs can be used in the health domain. From and I agree with what Brian has said as well. It's not only just about the ICT, the hardware and the software, and there are more complex challenges related to management, to the issues of health data standardization, and issues of access and affordability, which was mentioned in the case of Pakistan. So I'd like to come back to these challenges in a moment. Now I'd like to turn to look at how citizens or consumers, patients, and caregivers are using ICTs. So many countries are now focusing on patient-centered healthcare and providing patients with access to their health records, for example. So at the same time, with greater access to health information through ICTs, patients have the tools to take better control of their own healthcare and become more involved with their healthcare. So I want to ask, to what extent is this happening in Asian countries? And what are some of the stories and examples that can be shared to illustrate the success or the challenges of empowering and engaging with patients' families, or even with the larger communities through ICTs?
Well, I think it's still some way to go. We in Asia, I think the idea of taking responsibility for your own health, challenging a doctor, not negatively, but in the sense that you want to know more about what's going on, why the treatment is prescribed, is still a long way off. And when it's ICT, it can work both ways. It can work in the sense that the patient feels less intimidated by not having the doctor or the medical personnel in front of him or her to respond, but it could just as well be even more intimidating when you don't have the reassurance of a medical personnel, and coupled with the sort of non-humanness of the ICT area, where if you cannot see the person, if you don't have the video link, then it becomes even more intimidating, especially with the communities that are less connected and less familiar, the older generation that is not so comfortable with using the internet. I think that's one of the biggest issues, I think, of the ICT use, but nothing that I think is insurmountable, nothing that won't change over time, I think.
Thanks. Any other insights or thoughts on this? Albert?
Yes, I agree with Brian that there's still a long way to go to there, because especially here in Indonesia, where the internet connection is still limited in some areas, in most areas, I think, and patients' awareness about his or her own medical records, they usually just give the trust to the doctors for their medical problems, and I think most of them, they just don't care about why the doctor give them a prescription like this or that, and also we're still having a health data standards problem. So each medical facilities may have their own data standard. So if one patient go to one hospital and then to another one, I think there's no possibility here right now to share the information between the medical facilities. So I think it's a long way to go there for now.
Okay, thanks.
Can I just add in, I think today was interesting in Malaysia. The media released that Malaysia has the 18th best health system in the world globally, right?
Yes.
And I think it's interesting for our neighboring countries, as much as we are the 18th best in the world, depends on which part of Malaysia you go to. If you go to the island of Borneo in Sabah and Sarawak, where the link to a clinic is just so far away, then the problems of basic healthcare, even water, sanitation, is a bigger issue than that. So I think it's interesting that it would be good if we highlight the issues faced in Malaysia with our very advanced, in some ways, in Kuala Lumpur, for example, e-health is very advanced in some locations, and we are very far behind in others. So it would be good, I think, if we could actually document this and share this with our Asian brothers and sisters for why reinvent the wheel. The one big lesson we learned in Malaysia, that we invested too much money in the beginning into things that were so complex that in the end the systems failed. They were just too heavy for the average doctor and medical personnel to understand, and it became just who is better, and the doctors were intimidated by the ICT, and the ICT personnel, of course, couldn't understand the system that exists. So there has to be a sort of a more gentle manner, and I think the lessons learned in Malaysia is so diverse that it would be good to share that if we had more knowledge of what has happened, because there are extreme good lessons in Malaysia to learn. In fact, I was reading a report yesterday that the doctor said that one of the mistakes they made was investing too heavily and going too big too fast, when a simple thing like a digital camera, for example, would have sufficed, to take a picture and send, would have been the first step, rather than creating, imaging and MRIs and all that stuff that just when I'm not saying it's bad, it's good, but it's step number 5 or number 7 or something, but definitely not number 1.
May I have question to Brian?
Sure, yes, please.
As I am a technical person, I would like to know how the interoperability and data standard handled in Malaysia.
Because I'm not an ICT person.
Yeah. I know.
What you mean by that, So
okay. When the data need to be shared between one medical facilities to another, between one doctor to another, they need to understand one another. The data they share need to be understand one another. How do you handle this in Malaysia?
Well,
do you have one health data standard to use across Malaysia?
Well, I mean, it is one health standard because it's under the Ministry of Health. So they finance this to the tune of hundreds of millions of ringgit, right? So definitely they created, they hired one vendor who was supposed to provide the system, but unfortunately, not every hospital was given its own mandate. It was not standard across the board. So I think that was the issue. So exactly what I don't know the details, but I know that it wasn't one vendor across all Malaysian government hospitals, right? But what happened was, when vendor A tried it in hospital A as the pioneer, and it didn't work, then they learned from that, and the next hospital then did it better. That's what I understand from the report. I don't have the details of that, but I can definitely share with you the report. It's actually quite simple, a short one that gives you an interesting overview for your knowledge. I have it with me. I can save it and send it to you.
Yeah. To add to that, my colleague, Kyril from e-DIRAP, mentioned that he's also from Malaysia, and he says that Malaysia usually follows ISO standards and then ratifies it as local standard by one of the Malaysia standard body. So they follow international standards but make it into a local standard.
Because now in Indonesia we have talks and discussion about the health data standard. So, for example, when one doctor diagnose the patient with tuberculosis, maybe they need to put the standard code for the diagnosis to be understandable by another physician, another doctor in another place. When we don't have one standard code for that tuberculosis, then maybe the other doctor won't know exactly what the diagnosis the other doctor gave to the patient, and that's just for diagnosis. And we need to have another standard for the prescription for another medical status.
Wow, I actually I've never heard that being an issue in Malaysia. Never.
Oh.
Because you mean of a different medical standard for judging each medical issue? Not that I know of, because I mean though I'm not in the medical field per se, I'm quite close with many of these programs because of my community programs, and I've never heard of that issue coming up ever. So I think the bigger issue we have here is not so much the medical issue from diagnosis, but more the fact that we have alternative medicine and the bomo or the shaman, and that becomes an issue because they are considered equal to doctors in some areas. So that's when there's no standard, obviously, because each person is different. You know, each shaman is different from the other, and then that becomes an issue. So that is a bigger issue here. You know, much bigger.
Oh, Christine, I would like, I guess, to answer your question, I would like to say that the problems highlighted by both of my panelists are almost the same. Look, adopting ICT is expensive, okay, in the beginning. We find the results in later years, and that is what has happened before as well. Huge investments take place, and sometimes we get the results, sometimes we don't. So this is a problem again in Pakistan as well as all in other Asian countries. The other one is like ICT has helped everybody else to provide health awareness to everybody. Okay, that is true. But then further, how that health awareness is used, it depends on other factors that are literacy rate of the country and things like that. So like my co-panelist mentioned, that e-health is being adopted in different countries, but slowly and gradually, and there is no set pace of adopting or setting e-health. We need to have e-health policies on governmental levels, which is something which we don't find these days. Only a few countries have done that. And if we talk about Pakistan, our health system was first being guided by our by our federal government. Okay, now it is subdivided into provincial governments. So you can see how things change. Now health has come down, has trickled down to the provincial levels in Pakistan. So now things would be different. It would be easier to adopt as well as apply e-health strategies to Pakistan as well as other countries as well, I guess. And now it's high time that countries start giving health sector an importance, so much importance that they should know what is going on all over the world. So ICT, I think, has helped in this regard, that we can know what standards are being followed in other countries, and then we can adopt and change them according to our standards, local standards. It is not possible to follow a health standard in different countries, the same health standard in different countries, because of many reasons, because of the geographical, the scattered places, because of the literacy rate in the country, because of many things. So I would add that the same thing, that the problems are same. Still, people don't rely on being treated from a faraway doctor. Although the doctor may be same, they want the doctor to be in front of the patient. Wants the doctor to be in front of him and then treating him, instead of getting treated by a doctor who is far away in location. So I guess this is from my side.
Thank you. Thank you for sharing your experience in your countries. like to talk a little bit more about health data, because I think this is one of the topics that when we talk about e-health that comes up quite often, and Albert has initiated some and discussed some of these issues related to health data. I'd like to ask the panelists, to what extent is health data available in your country? And I'm going to ask a series of questions, and you can decide, you want to answer all of them or part of them or just one part of it. So firstly, to what extent is health data available in your country? How is it being made available and for what purpose? And then there's an issue when we talk about health data, the issue of patient privacy, and how is this being addressed? And taking this concept of patient-centered care, how do you think we can coordinate data into something that patient can see and benefit from? Because at the moment, I mean, the data is very difficult for analysis, and Maria talked about, data literacy and how to get people to understand it. But from, a person who is processing the data, how can we make the data more digestible for a regular person? Any thoughts on this?
I mean, why would a regular person want to access the data in the first place? I would suppose the data would be accessible to the medical professional. For example, the National Cancer Health Registry, the National Thalassemia Health Registry, all these kind of sort of blood disorders, especially that are treatable, that are usually not, because it's not seen. It's an issue that's not seen, unlike a more physical illness. So I think data collection is I mean, generally, I don't wish to what you call generalize, but I think generally that's one of the weaknesses. Data is one of the weaknesses in Malaysia. But having said that, medically we are pretty much up there. But how it's linked to the social issue, the human issue, is the lack of connectivity, if you know what I mean. And the big thing, in my opinion, is the privacy issue. The concept of privacy is still not understood, that you just don't share that a woman has got a lump in her breast with everybody. It's her choice if she wants to make it public or not, and for that matter, any medical issue. But we still have a long way to go about that, I think.
Thanks. Albert?
Here in Indonesia, when the patient want to get his or her own medical records, they can just ask to the doctor to give them the records. But I think no other things. I mean, that's the only way how the patient get their data. About collecting the data for the government, each medical facilities need to send a report to the government. The government has a standard form to be sent each month to the government. So this is the way the government get the data from the medical facilities to track maybe some important diseases, to know how they spread. But for the personal, for the patient, I think that's the only way to get the medical records.
And is this information available publicly? That the information that's sent to the government?
Which data? The patient data, or
the one that on the diseases, and for example, it may be dengue diseases, and what are the areas that have dengue outbreaks, that sort of thing? Are these available publicly?
Because now in Indonesia, the policy is up to the regency policy, not too much in the central government. So it depends on the regency government to share that kind of information. If they have a website and they maintain it well, they can share some of the collected information there.
Okay, thank you. Maria, do you have any thoughts on this topic of health data?
The same issue we face is when look, there are two types of hospitals in Pakistan. Okay, some are government public hospitals, and some are private hospitals. So, although private hospitals in Pakistan have adopted a process which can save patients' data, but public hospitals do not presently have this system. So, like Albert said, like sharing information to the government, I don't think so that can happen in Pakistan at present or in future years. So there are different things being adopted or happening in Pakistan. We can't say something like how or when this would be accessible to people. And same, people are not patients are not ready to share their personal information with others. So the data records are kept with their doctors or in hospitals in the private sector. So this is what happens in Pakistan.
Okay, thank you. Okay, I'd like to now turn to look at some of the specific ICT tools that are being used in healthcare. Could the panelists share any promising examples, innovations, or ideas, including the use of mobile technology, social media, online platforms, etc.? Particularly if you could share those initiatives that have the potential to be replicated or adopted in other countries or scaled up.
Like I mentioned, I would start with an example. There's an organization in Pakistan. You people can search for it, and it's called Aman Foundation. It has a call center which is available for everybody 24/7 only on a call. Okay, and general call charges are charged, and it provides health advices. People sitting in the call center are either doctors or nurses who can give health advices. So this is an example of like mobile health or telemedicine being used as an example. Um, so people can get access to healthcare maybe only a call away. Okay, for minor issues, people don't know how to solve many minor problems. People living in villages, there are many villages in Pakistan, in all the provinces. So people far away do not have to come to Karachi for many petty small issues now, and they can call and get the advice. Like for instance, if they feel their children are malnutrition, so they can call and ask. Which the malnutrition can lead to bigger medical problems. So to prevent that, the people can call and ask Aman Foundation call center for this. This is one of the examples.
Okay, thanks. Any other examples, Ryan or Albert?
Well,
okay, Brian first.
Well, in Malaysia, I think, Albert, I just checked the document again for a bit. Actually, we have a telehealth policy where, for example, if a patient is living in Kuala Lumpur and moves to another city in Malaysia, the data of that patient actually need not be brought by the patient anymore physically. Everything is actually now in a national health database system. So any Malaysian patient who is registered with a government hospital, regardless if it's a government servant or non-government servant, their data is now kept online and can be accessed anywhere. Actually, the only
good.
It is. It's actually quite impressive. Actually, I know of it personally. I have a 88-year-old mom who just got sick, and the system was actually quite impressive. And for a 5-day stay together with probably 16 to 18 tests, including MRI and what they call it, sonogram, and a bunch of other tests that in a private hospital will cost 10 to 15,000 US dollars. I paid $200 US. So it's really quite impressive actually. So if anyone's above 60, the government charges a very nominal rate for this. So I think is something quite impressive, despite the advent of telemedicine and this data, and the human touch, and also the consideration of cost has also been taken into account. So initially the cost may be very high, as it is with implementation of all systems, but in the long run, it has resulted in a much more efficient management of patients.
Is it only for the state hospitals?
Yeah. I mean, obviously, private hospitals have it online and they can transfer it if they want to, or if you ask to. Yeah.
But how if the patient go to the private hospitals? Can they share the data from the private hospitals too?
Yeah, they should, because they pay for it, so they own the data, right?
I mean, the data of the patient in the private hospitals, can it be shared to another hospitals?
To the other government, if the patient asks, if the patient releases it, yes.
Okay, that's good.
Yeah, because I think there's the issue of sometimes when you do various tests in certain places, there's this issue of patients having problem getting access to their own data and sharing it with others. So that's there is this issue. Anyway, we're running out of time, so we don't have any questions from the viewers. So I'd like to ask a final question to the panelists. So we've discussed some major challenges in e-health today. So of course we've heard that ICTs alone do not improve health outcomes. They require major shifts in behavior. You need policies and governance framework in place. You need awareness and capacity to be able to develop and use these various systems and data. The systems and data, they need to interoperate, and there needs to be some sort of standards. There's also the issues related to privacy and security. So many challenges. So I'd like to ask the panelists, what small achievable steps do you think can be taken over the next 1 to 5 years to address some of these challenges in improving the access and quality of healthcare through the use of ICTs?
I think for me, bearing in mind the major health challenges in Malaysia is with the migrant population and also with our rural population, I think a greater use of mobile technology would be of use. I think it's great that we have all these fantastic systems, but I think sometimes it's too much too soon. And maybe start with a more simple platform, include mobile technology in various languages of all the many migrants that work in this country. Because at the end of the day, whatever, they may not be citizens of the country, but their health issues become our health issues, and it makes sense to deal with that, in a logical and systematic manner. So for me, mobile health technology would be, apps that have value, I think, for them to understand, and for accessibility of where there are free public clinics, for example, or clinics that offer health services to migrant workers at a cheaper cost would be something that I would look at. Again, start small. Don't go for the, there's no point reaching for the stars when the low-hanging fruit are not even dealt with in the first place.
Great, thanks. Maria, would you like to share your insights?
Yes, I also agree with Brian, because these days a mobile phone is in everybody's hand, and it is being used for communication only. Okay, so if you're talking about the first two steps, I guess yes, awareness, basically awareness through social media, which is already being taken, as well as through using mobile technology. We can basically access a person who is living very, very far away in a country and cannot come to a main city. So I guess, and in a very small cost. That's the basic thing, that he wouldn't have to pay anything extra. So access on messages, access on if we even forget that internet is there, because many people do not have access to internet. They're not literate enough to use internet. So, but still they can use a mobile. So I agree. I guess if we talk about ICT, mobile technology is the only thing accessible as well as used by everyone in a country. So that's all.
Thanks. And Albert, you have the last word.
Okay. About small steps, I think it's not small, but it's important one for us in Indonesia to be started. The first, we need to establish health data standard before anything else. So through that standards, each medical facilities can talk one another. And then the second, we need to raise awareness to the medical staffs everywhere that the data is important and they need to keep the data carefully. Maybe that's all from Indonesia.
Okay, thank you. So we've come to the end of the Hangout, and I'd like to thank the panelists for taking their time to share their rich insights and experience with us. I'd like to also thank the viewers for watching. So the recording of this live broadcast will be publicly available on the e-DIRAP YouTube channel in a day or so, and there'll also be a written summary of the discussions today. So thanks again, everyone, and goodbye for now.
Okay, thank you.
Thank you. Bye.
Bye. Thank you.